Well, good afternoon, everybody. I want to start by thanking John and the team here for hosting us today, and to your partners at Cartamundi Manufacturing Facility. I also want to thank Congressman Neal for joining us today, and not just for today, but for all the work he's been doing, not just for the people of Massachusetts, but for the country. And I also just have to say, as I walked through there, it was like watching my life flash before me as I saw one game after another, that have all spent time on kitchen counters, dining room tables, family rooms, over the course of my lifetime. This really is a collection of iconic games and iconic brands here. With respect to testing, which we always try and give an update on, yesterday there were about 20,000 tests that were processed, which is about 5,000 more than the day before, which gives us a total testing so far of about 215,213 tests. Of the 20,000 tests that were done and processed yesterday, 4,946 were reported as new confirmed cases. We're also doing a lot more testing. We've talked about this in high-risk, high-incidence areas, nursing homes, rest homes, assisted living residents, hospitals, and communities where we're particularly concerned about what's going on there. And the high number also includes an update from Quest, which shared a batch of testing with several states, including Massachusetts, that dates back over several days. We also have set up more testing sites to make it more accessible to people. We announced last week a program to implement a testing facility that would serve about 15 or 16 community health centers around the Commonwealth, all of which are located in places where we wanted to see more testing done. And typically community health centers are often the front door for a lot of folks in those communities, and a trusted care provider. And we're thrilled to have so many of them partner with us. We also talk a lot about where we are in hospital capacity. At the end of the day yesterday, there were about 18,200 hospital beds available. 55% of those beds remain unoccupied and available for patients. This is a really important issue. We are in what we've referred to as the surge here in Massachusetts, but at the same time, people did a lot of work to make sure that we would have the hospital capacity and the healthcare capacity that we would need to not just serve people who are dealing with COVID-19, but also to be able to take care of all the other maladies, illnesses, diseases, and issues that people face who are dealing with chronic conditions or acute incidents. And Bay State Healthcare in particular made clear to us when we had them at a press conference the other day that yes, they had 150 COVID patients, but they also had 400 other people in their hospital that they were serving at that time, and they had excess capacity, staffed capacity, that would be available for anybody who needed it. I can't express this enough. People worked really hard to make the healthcare system flexible enough and large enough so that we would not only be able to serve the people who were dealing with COVID-19, but that we would not suffer what had happened in many other countries over the course of the past few months, which was losing the ability to take care of everybody else. We have that capacity, we have that ability. It was a big part of our planning. And if you feel sick or you're dealing with a chronic condition, we just urge you, take your dialysis treatments. If you have cancer or any sort of other major illness that you're dealing with, make sure you're talking to your healthcare providers. And if you feel really sick, you should go to the emergency room. People have done a terrific job of organizing their emergency rooms in a way to ensure that folks who aren't dealing with COVID are dealt with separately from folks who are. And we don't want people to put off care that they need because they're concerned about the system being overwhelmed or the inability to actually get taken care of. They will. About 8% of the total confirmed positive COVID-19 cases are currently hospitalized, and that number has remained stable for quite a few days now. And we continue to manage and watch the hospitalization rate and hospital capacity issue very carefully. That's a daily communication that goes on between our command center and our medical professionals around the Commonwealth. The Lieutenant Governor and I on a call every morning with our colleagues in the healthcare community just to check in and see what's going on. And while people are certainly working hard, the good news is they have the ability to not just serve the COVID folks, but also to take care of others as well. And I can't stress that enough. With respect to personal protective equipment, which is part of why we're here today, we've delivered over 6.1 million pieces of PPE. This includes masks, gloves, gowns, and ventilators, which have been distributed to healthcare organizations, healthcare workers, first responders, local communities, long-term care providers, and others. And this week we were proud to announce that we were also distributing approximately 200,000 respirator masks for all law enforcement officers and firefighters throughout the state. And obviously today we're thrilled to be here to join Hasbro to announce further PPE resources for our frontline workers being manufactured right here in Massachusetts. I think you've all heard us talk a lot over the course of the past few weeks about the challenges we've faced in trying to get PPE into the hands of our frontline healthcare workers and emergency first responders. Today we had the opportunity, the Lieutenant Governor and I, to tour Hasbro's games manufacturing facility to see how they've adjusted their day-to-day operations to support the fight against COVID-19. This is a big deal. They've stepped up, reconverted some of their operations, created the space to safely make it possible to manufacture gear to support our frontline workers and first responders. There's no secret that for years Hasbro's provided families with lifelong entertainment and joy, and now they're providing 50,000 face shields every week to local area hospitals in Massachusetts and Rhode Island. This incredibly generous donation will save lives and will protect our healthcare workers. Yesterday, Hasbro also donated 250 face shields to the Holyoke Soldiers Home for staff and for caregivers, and which are treating our state's beloved veterans. And I just have to say, on behalf of the Baker-Polito administration, everybody who's part of our team, and the people of the Commonwealth, we are incredibly grateful to Hasbro and its team for the work that you're doing, leading here and supporting your healthcare workers here in Massachusetts and in Rhode Island. We've also worked hard to find creative ways to secure PPE for medical workers and first responders throughout the state with other folks. We've continued to work supply chains, but we've also looked into our own businesses right here in Massachusetts to help produce life-saving gear and supplies. Last week, we announced a new initiative and more than $10 million in funding to support manufacturers' efforts to pivot production operations to produce PPE and other critical devices, such as ventilators, sanitizers, and thermometers. This funding assists manufacturers in scaling their operations to produce PPE, and companies can apply for these grants through an online form for equipment, materials, supplies, workforce training, and other needs. As of today, there are over 600 firms that are working with our team on this initiative. 400 of those companies are based in Massachusetts and represent 161 communities throughout the state. Participating companies run the gamut with respect to industry and commerce. They include 99 Degrees in Lawrence that shifted from exercise apparel to making medical gowns, Gillette, Procter & Gamble in Boston, which is now also producing face shields, greeting card company Love Pop in Boston that's producing masks, gowns, and shoe coverings. And right next door in Lee, Boyd Technologies has partnered with us to adjust their operations and will produce face shields and 3D printing packages for nasal swabs. Hazen Paper Company in Holyoke, famous for its hologic images and publications like the Super Bowl program, are now making hand sanitizer. Universal Plastics in Holyoke is now making face shields and acrylic intubation boxes. Smith & Wesson is making protective face shields and donating that PPE to the city of Springfield. We're also grateful to participating companies that are working with us on these initiatives, and we're especially grateful to Hasbro for the work that they're doing here to support healthcare workers and the people that our healthcare workers serve. People have been working this one hard for the better part of the past 6 to 10 weeks, and we could not continue the life-saving, selfless work if it were not for the imagination, creativity, and generosity of companies like Hasbro. Now more than ever, as we face COVID-19, and especially the surge here in Massachusetts, it's imperative that we stand together as a united front. We owe it to our frontline healthcare workers who are receiving this critical PPE, and to all of our loved ones, our friends, and our neighbors to keep up the fight against the virus and to continue to work together. I now want to turn the podium over to my friend and your Congressman, Congressman Richie Neal. Thank you.
Thanks, Governor. Thank you, Governor. Let me just say that the cooperation between the Governor and the Lieutenant Governor and myself and the people of Central and Western Mass is noted every day. I've talked to him extensively, and in the last round of Phase 3.5, we were able to include a couple of requests that he had based on his request for more money for CDC and for the FDA. But as I'm looking at Cartamundi here, I'm reminded that the phrase says one group. And Hasbro, for as long as I can remember, and Milton Bradley, they've been a very important employer. And you walk through that facility today, and you not only note the management, but also the United Food and Commercial Workers. Think that in this facility, they're able to compete internationally. It's a great domestic manufacturing story. And date myself a bit, I knew the Shays and the O'Donnells very well when they owned Milton Bradley, and then the Hassenfelds when they owned Milton Bradley, but they've always kept their word. And you can see it witnessed today as we move through the facility. We're just off, as you know, 3.5, as we've called it, in terms of federal assistance. This is really important, and I want to emphasize this. So there was an additional $310 billion under the Paycheck Protection Program. Our idea here was to keep an infusion of money in the system. So there were only 5 members of the House of Representatives who voted against this legislation this week, and the Senate voted for it unanimously. Call attention to that, because not only was there money in there, once again, for those in the small business community, $60 billion is set aside for small business people. There is a provision in there for women-owned businesses, for minority-owned businesses, for Indian tribes, for our veterans, and for agriculture. That's a very important dimension to what we accomplished. And simultaneously, $75 billion for our hospitals. Our hospitals across Massachusetts are arguably the best in the world. And the first tranche of money, we used the pipeline of Medicare, so some of our bigger hospitals did fine. So in this round, I spoke with Secretary Azar last week at length about the next tranche of the $100 billion, so the next $30 billion we believe will be allocated to the Medicaid hospitals, the disproportionate share hospitals. Those are people that frequently just come through the door in terms of health care. So for the community health centers, for the Medicaid hospitals, for the Medicare hospitals, by the way, we are not saying in this instance here that what we're doing in this round is a substitute for the Medicare hospitals. We're saying that the Medicaid provisions are in addition to what they do. So that's a very important consideration. And $25 billion for testing. We are not going to establish confidence and hope in the marketplace if people are afraid to go to work. And as we walked in here today, I thought it was kind of interesting when the governor, lieutenant governor, and chairman of the Ways and Means Committee, the nurse said, line up. She took our temperatures. It's good for humility. And I think that's going to be part of the way of life as we go forward for a long period of time. And now, I have already been working on Phase 4, which is going to include help for states, cities, and towns across the country. I spoke with the Speaker extensively over the week, and in fact talked to her almost hourly. But our plan is to go forward to come to the aid of the first responders, to governors like Charlie Baker and Lieutenant Governor Polito, and to those governors across the country who are on the front lines, along with mayors and local officials. So we believe that we will find a negotiated position on that, but we're already at it. We're already working on it. And I think that when you look at the exhaustion of state revenue, it's amplified by the fact that this is still going to be with us for a while. So that expenditure is a wise use of the public purse, and we believe that we will have a proposal in the next 10 days that we intend to put out. I think that there's going to be a need for more unemployment insurance. The first 12 days exhausted the supply of the Paycheck Protection Act, and there likely could be another infusion for individuals across the country for the $1,200 for single filers that we put in place. 80 million people have received those checks. I want to emphasize that, 80 million people. We use the Social Security Administration for our Social Security recipients. That money should be arriving momentarily. By Wednesday, the hospitals will know what their allocation is under the Medicaid and Medicare guidelines as well for the next round of tranching, as I noted it. But between unemployment compensation, the Paycheck Protection Act, and I got to tell you, just so you, for media, I went to the best minds in America on this to figure out how to proceed. And the Republicans and Democrats all came up with the same conclusion. That money needs to continue to flow every day, and that was the point that we would use to undergird the Paycheck Protection Act. That is critical. So, infusion of money, making sure that people at the bottom end have sustenance, understanding there are people without tax IDs, so we're trying to use Medicaid records to get the money to them as well. And I think that despite some of the acrimony that you witness from time to time, it's really important to emphasize, only 5 people voted against that legislation. So you've had 4 major pieces of legislation now that have had all bipartisan cooperation to get the money out the door to people who need it. And I just want to thank Cartamundi and Hasbro and the family here. I was here with them last couple of days ago, and I'm going to emphasize again, you talk about what they did in transition right away. They called me. They called me to tell me what they were doing. I've been through this facility many, many times over the years, and it's a terrific story. And I want to thank them for what they're doing on the front lines. I know they're as anxious as everybody to crank up those machines again and get going, but they've also done a nice job in the interim. So thanks to you very much, and thank you, Governor Polito as well.
Thank you and good afternoon. My name is John Friscotti. I'm the President and COO of Hasbro. On behalf of everyone at Hasbro and our partners at Cartamundi, I'd like to extend a very warm welcome to the Honorable Governor Baker, Lieutenant Governor Polito, and Chairman Neal. And we are so appreciative of your leadership during these challenging times. So from everyone at both companies, thank you very much. The reason we're here today is, as you heard from the governor, we have begun to transition our factory from making some of the most beloved games that many of us grew up with, Monopoly, Risk, Clue, Candyland, Game of Life, Dungeons and Dragons, and we are now making face shield for our frontline healthcare workers. And we're doing this because it's part of our purpose as a company to make the world a better place for children and their families. And we're doing this because it's the right thing to do, and we're just so grateful of the opportunity to work with Cartamundi to serve this need. So I wanted to thank all of the workers here today who are making it possible for us to do this. I wanted to thank our tremendous team at Hasbro and at Cartamundi for your hard work. And I wanted to thank, obviously, Governor Baker and Lieutenant Governor Polito and Chairman Neal for their incredible support through this effort. It has really been a great experience for us, and we're just incredibly grateful for the opportunity. And finally, I just wanted to thank all of the healthcare workers in Massachusetts and Rhode Island. We will be donating these face shields to them, and I wanted to thank them and thank all the healthcare workers around the world for their incredible sacrifice and for their courageous service. They are our heroes. So thank you very much, and thank you for the opportunity.
Questions for any of us?
Governor, you talked about the Holyoke Soldiers' Home. Now that we're up over 60 deaths attributable to COVID-19, when can people expect results of any kind of investigation, and has any employee been disciplined other than Mr. Wong?
So obviously this whole issue is a terrible tragedy, and the Lieutenant Governor and I both actually were updated on where it was on a Sunday night, and on Monday morning, we had a new clinical team in place there to stabilize the operation, deal with all the infection control issues, and called in the National Guard to support the efforts of Val Liptak and the team that she brought in. And I do want to give a special shout out to Holyoke Medical Center for standing up a COVID-19 unit in a matter of days to serve many of the veterans and residents who had tested positive. Mark Perlstein, the former first assistant in the U.S. Attorney's Office that we hired, and by the way, he's doing it for free, that we hired to conduct our investigation. We speak to him on a regular basis and have said to him, the only thing we've said to him is tell us if you have any issues or problems accessing information that you need to do your work. And he has not expressed any issues with respect to that so far. But we have made clear to him that he has free rein to conduct the investigation, and obviously we would like to have it sooner than later, but we also want him to make it as complete and as thorough as he believes it needs to be. But he is the right guy for the job.
Is there a date or a time frame been discussed?
We've told him basically to, if you have any roadblocks with respect to what you want, tell us so that we can get rid of them. But I want him to have the time that he needs to do the investigation.
Governor, you mentioned the backlog in testing.
Say again?
You mentioned the testing results that came out yesterday. They included a reporting error, a backlog
Yep.
going back up to 12 days. Have you been able to get any explanation about why that backlog formed? And were patients also delayed in learning their individual results by up to 12 days?
No, this was a reporting issue to us. It was not a reporting issue to the institutions and facilities who requested the tests in the first place. And apparently this was true in a number of states. And my guess is, I think Quest is doing somewhere between, I think they're doing somewhere between 40 and 50,000 tests a day at this point. And I am, I am of the mind that the information that needed to go back to the people who actually ordered the test got there in an appropriate time frame. They've been pretty regular reporters to us over the course of the past 6 weeks or so. I don't know exactly what the issue was, but it was a reporting issue not just here but in other states as well. They're now completely up to date. But the people who actually requested the test got their data back and got it back in what I would call sort of due course. They were not delayed.
It sounds like you still have faith in this.
Oh, Quest has done a terrific job with a lot of our key partners. They are our partner for the initiative we just rolled out with about 15 or 20 community health centers. And they completely retrofitted. I mean, they did something similar to what we're talking about here. They had a big lab in Marlborough that was not doing COVID testing at all, and they, in a matter of days, converted a big chunk of one of their main labs there to do nothing but COVID testing because they wanted to have a presence in the Northeast so that they didn't have to send those tests to other parts of the country and then get them back. And they've conducted they have processed an extraordinary number of tests on behalf of primarily healthcare organizations over the course of the past 4 or 5 weeks.
Governor, could you speak a moment about the cooperation between you and other governors? I know that a number of states have talked about how do they reopen and if there's a coordination effort. Could you give us some idea about maybe where that is and what those discussions are like?
Well, first of all, one of the biggest challenges with respect to coordinating our efforts is where you are with respect to the surge, okay? We in Massachusetts are in it. Vermont is past it. New Hampshire is probably on the backside as well. Connecticut's about where we are, and Rhode Island, I think Governor Raimondo would say she thinks she's about a week away from the surge in Rhode Island. New York, obviously, at this point is over it. New Jersey's just about over it. But part of the reason for the constant conversations between governors and others in the Northeast is we do want to be coordinated on any effort we pursue to reopen. We also want to be coordinated given that we're not all in the same place. I don't want Maine or New Hampshire or Vermont or Connecticut or Rhode Island or New York, which are states that border us to do something that they believe is an important part of their reopening that unwittingly creates issues for us. I certainly don't want us to do anything that creates issues for them. And I would fully expect that states are going to talk a lot on a regular basis over the course of the next month, probably the next 4 or 5 months, as people move forward on some of the issues associated with reopening when they get past the surge. We'll share best practice ideas. I mean, we were on a phone call today where a lot of the ideas that we were discussing are not just ideas that came from other states, but things people are doing in other countries. The tracing initiative that we launched with Partners in Health to do contact tracing on anybody who is deemed positive, to sort of supercharge the tracing program that was already in place, to be able to scale it and to be able to make sure that we do the work we need to do to isolate people who test positive and those they've had close contact with on a go-forward basis. That idea came from people who were familiar with work that was being done in South Korea. And we've had numerous governors and public health offices reach out to our administration and to say enough that the National Governors Association decided to actually put together a call just to talk about that. I mean, I think you're likely to see contact tracing programs all over the region, and I think that's a really good thing.
Last question.
Are non-essential businesses still going to be open on May 4th?
So we're in the process of reviewing what I describe as the key metric here is not May 4th. I mean, that's where the emergency went, the emergency order went through. And it went through to there because we felt it was important to send a pretty clear message to people that certain businesses would be deemed essential by the federal government and by the Commonwealth, just as many other states did. But we wanted to make clear that we didn't want people to think they were going to be reopening tomorrow or the day after or the day after. And May 4th was based on our assumption that we were going to be in the surge at some point in early April. The surge has been a little bit later than that. Any decisions we make with respect to reopening are going to require two things. Number one, the same thing it requires almost everywhere else, which is some drop in hospitalization rates and some evidence that we are in fact over the hump, okay, with respect to the surge. And then the second is putting the rules for engagement and reopening in place, which we'll have a lot more to say about next week.
Governor, a lot of cities in Western Massachusetts are implementing masks to be mandatory in essential businesses. I know Maryland has done that as a state. Any outlook on if Massachusetts might mandate that be ordered here for the entire state?
So we have put an advisory in place with respect to masks. If you can't, or face coverings, if you can't assure yourself that you can maintain distance when you go out, we're encouraging people, urging them to either wear a face covering or to wear a mask. And there are two big reasons for that. Most people think they wear a mask to protect themselves. That's certainly true. But the other thing everybody needs to understand is one of the key issues that has sort of emerged about COVID-19 over the course of the past 4 or 5 weeks is that a significant percentage of people who are in fact COVID-19 positive do not show symptoms and may never show symptoms. So they are carriers, they can infect other people, they are contagious, but they have no sign. They don't have a temperature, they don't have respiratory issues, nothing. All right? Those people, one of the reasons for saying people need to wear a mask is so that if you are one of those people, you are not going to be easily spreading it to others, and that's a big part of the reason why we've talked about the importance of wearing a mask. I certainly believe that whatever the rules of the road look like for reopening, masks and face coverings are going to be a big part of it, have to be. Well, the advisory we put in place, you don't go inside a lot of companies at this point or even see a lot of people walking around on the street who aren't wearing some sort of a face covering. People have been I think people in Massachusetts have been terrific about responding to the advisories and the guidance that they've gotten from us and from their local communities. And one of the things we've tried to do here is to create a framework at the state level for a number of these issues. And then if locals want to go beyond it or do something a little different, we wanted to, based on their own on-the-ground circumstances, we wanted to give them the ability to do that. And that's been true with a number of the initiatives that we've done, including this one.
Thanks, everybody.
Thanks, folks. And again, thank you to Hasbro. This is very special. We really appreciate it.